Welcome to the We're Good podcast, where we are celebrating the everyday brilliance of people working toward a more positive world. If you're looking for the good that's taking place around you, you've come to the right place. It's a topic that touches millions of lives, Alzheimer's and dementia. The Alzheimer's Association says 15 million Americans either have the disease or are caring for someone who does. Today, a local geriatrician, professor of geriatrics and palliative care, and an expert in the field sits down with us about prevention, diagnosis, and care. Dr. Christina Prather has some advice for all of us on this journey called aging. Today on the We're Good podcast. Welcome back to the We're Good podcast. I'm Ann Necessary Brownlee, your host, and today, during the month of November, actually, we are taking a look at Alzheimer's Prevention Month. We're looking at dementia, we're looking at prevention, we're looking at care and talking about caregivers. And I'm so excited to be joined in the studio with Dr. Christina Prather. Thank you so much for joining us today.
Thank you for having me. This is exciting.
I said you are one of our first experts that's joining us on We're Good, and we appreciate it so much. So that everyone knows your background, you are the director of the Division of Geriatrics and Palliative Medicine, also an associate professor at George Washington School of Medicine and Health Sciences. We just greatly appreciate you bringing your expertise and taking time out of your busy schedule to do this.
Well, I'm so grateful to be here. This is an important topic, and any opportunity to talk about how we prevent dementia, recognize dementia, and live well with dementia is something that I'm going to say yes to. So let's do it.
Let's do it. I know, because we were talking about the fact that we had in our previous episode, Insight Memory Care, and they just really were able to share with us, with a caregiver who came to join us, just the scope that this is affecting so many. It's millions and millions of people, whether they are taking care of someone, whether they have the illness, or whether you know someone, a good friend who's taking care of someone. So this really, I would say it'd be hard to find someone who's not dealing with it at some point in their lives. So we just wanted to have you on because I said, you know, this is the We're Good podcast. And you were like, oh, but there is We're Good out there in the care for Alzheimer's, dementia, prevention, and diagnosis.
Absolutely. We're all caregivers at some point in our life, right? And right now, many, many people are caring for loved ones living with memory loss disorders, whether it's Alzheimer's disease or another dementia or cognitive changes after a stroke. We have to find a way to make it so we're good doing this, because this is the life and place that we're in right now in our society and in our communities. And you mentioned the community organization, and they're in the communities working with individuals living with memory loss and working with caregivers to make sure that people have the skills and ability to live well when memory loss is present.
And of course, you come at this from the fact that you are a geriatrician. Tell our audience about your journey and why you decided to go into this field of medicine.
So I think I never wanted, but always was going to be a geriatrician. So I grew up doing adoptive grandparent programs through my local church, spending a lot of time with my own grandparents who were aging in our community, sort of a very tight-knit family. I was with them all the time. And then ultimately earned a biomedical engineering degree at the University of Maryland. And I was thinking a lot about function. And I was thinking a lot about how do we best design for the best function across our lifespan. And that came from personal experience with health and illness and technology. Fast forward several years, I graduated, I built prosthetics for a while. I went to med school thinking I wanted to learn what physicians needed, and I wanted to design it. I fell in love with patients. I avoided making decisions as long as possible every time a career choice happened, until ultimately I fell into this place of loving complexity. So I told people I love to be kind of in the mess where nobody else wanted to be, talking about what should we do, what can we do, what do the medical guidelines say we ought to do, and then what's the right thing for any individual person. And how do we get to that if they can speak it themselves? And how do we help their family make these really difficult choices sometimes if they haven't been left guidance? And so I live in the space of geriatrics, which is really about how do we optimize how we age, how do we function, how do we do it with dignity and purpose?
I love that. And I love that you are working so hard at making some of it joyful, like taking it. You work at the GW Memory Clinic. So if you can tell us a little bit about what you do there, and I love what you said is your goal at the Memory Clinic.
So one of our goals at the Memory Clinic is to ensure that people have the best possible life possible when they have to live with a disorder such as Alzheimer's disease or a related dementia, right? We want to help patients and their families, whoever their family is, friends, loved ones, born family, found family, find and reestablish joy and try to make this not about living with the disease, but about living with modifications or a different baseline. So at the Memory Clinic, we see people who are starting to develop cognitive concerns, and we say, is this dementia? And if it's not, how do we reverse it? How do we intervene now and aggressively to prevent this from progressing? For people who are diagnosed with dementia, how do we slow this down? How do we give you the best life possible as long as possible? Articulating your wishes and developing care plans that really optimize your function and quality of life. Bringing in caregivers, bringing in care partners, trying to think about the patient and family, capital F family, everyone who's in the room as part of the unit. And then we actually take care of people through the end of their lives. So we often will become the physicians overseeing care in an assisted living facility or helping families keep their loved ones at home with hospice through their final days.
So when you were talking about this, you talked about all the topics. It's prevention, diagnosis. Diagnosis is so important, and there's so many types of dementia. And then also the caregivers and the care that's given that they need as well. But when you talk about prevention, I think I told you, I had someone that I was saying, we're going to talk about prevention, and they they bristle. They're like, but I know someone who did all the right things and they still have Alzheimer's at age 60.
There are going to be cases where there's nothing we can do to prevent dementia. I'm going to be honest about that just from the get-go. But from a population health standpoint, we know that treating diabetes, high blood pressure, cardiovascular conditions like high cholesterol, from a community population level is going to make a difference over decades for populations at reducing all-cause type of dementia. That doesn't mean that for any one individual person, their genetic profile or the things that have happened in their life are going to be able to prevent them from developing Alzheimer's disease. And I actually really resonate with the comment that you shared from this individual, because so often I'll be sitting with a patient and their family, and they're like, how could we have prevented this? And they don't have any of these conditions I just mentioned. And in those cases, it is really hard. It is really hard. But there are things that we can do as individuals, right? So like on the upside.
I am 58 years old. What do we do? What do I do? That's right. It's time. So actually, it was time way back.
It was time in the 40s and maybe in the 30s.
Right.
We have to move our bodies. We have to fuel our bodies with the right types of nutrition, and our food pyramids keep changing, and what we know about nutrition and what's good for brain health is really emerging and evolving. So nutrition really matters. Moving matters. I'm going to go out on a limb to all the type A people listening today and say sleep matters. Sleep matters a lot. It's when our brain takes out the trash and consolidates memories. So all this pushing 5 and 6 hours at night stuff is just not setting up for long-term healthy brain aging. And we have to maintain purpose and activity and challenge ourselves to learn new things and take on new ideas. So there are things we can do.
I shared with you and you said, oh no, we should talk about this. That in a very simple way, a group of my college girlfriends we have been concerned about it. So we started doing like a brain health call periodically on Zoom, and kind of doing different challenges of things that we hear that are good. But also what we found is that we're sharing what we're learning. And you were like, that's part of community?
It's part of community. So when we talked about this, I was reflecting back on how we used to get our information about health. Did you pop open your Cosmopolitan magazine or your Vogue? Like, where did you get your information when you were a teen or when you were in high school and then when you were in college? And where do we get that information now, right? To learn what is normal or expected in any sort of thing you're trying to figure out, right? Our brains age, our cognition ages, our memory, our thinking, our word finding, how we multitask, it all changes as we age. And there's so much fear of Alzheimer's and dementia. We actually have to destigmatize and help people learn what's normal, what to expect. And so if you're talking with your friends and everyone's having a similar experience, most likely you're all just experiencing typical changes we expect of our body as we go through life, right? And so that's a good thing because now we're talking about it. And if one person's experiencing something a little different, well, maybe now they know they need to bring it up with their doctor. Maybe now they know they might need to have a conversation that is a little more serious so they can intervene on the front end.
And one of the things that a lot of people that we have seen is that you are getting so much information. So where does it, that's one of the things, like it's this supplement, it's this study, so can you, and I'm sure there's people listening, same thing. What do I listen to? What studies do I pay attention to?
So dementia is this incredibly complicated thing, right? Any of us who want to say that we have a magic bullet or a single pill that can fix this or prevent this, we need to take a humility pill, right? So there is no one way to prevent dementia or optimize your cognitive health. And a lot of the studies that we have are done in highly controlled environments to look for a single outcome in a population that might not look like you or might not look like one of our listeners. And so when we look at the studies or someone saying that, taking this vitamin is going to change how you can remember words or how your recall is, we have to look at who that study was performed on. What is that population? And does that even represent me? Does that population represent me? So really going to your doctor or your licensed health professional, advanced practice provider, nurse practitioner, physician assistant, whoever's you're seeing for primary care. For women, it might often be an OBGYN or someone they have a longitudinal care relationship with. And asking what else do I need to be doing? Really, I want to take my health to the next level. What do I need to do? And then we look at
because hormones play into so much, but there's so much information on that as well.
Right. And so we know that in the perimenopausal period too, now we actually should probably doing more hormone replacement therapy to help women age better longer from a bone health and a cognitive and a metabolic health standpoint. And so that's new and that's changing and people need to go in and have those conversations.
So it's really, there's no one thing that's going to fit everyone. And like one book, one study, one social media fad, nothing is going to be perfect.
If only it were that easy.
Right. That's right. But what you've seen, which I love, is that, and also you have also talked a lot, I know, in other podcasts about flipping the script and taking care of the caregivers. Because when you do get into this situation, that is also something that at this age, there's a lot of people that are taking care of kids and now taking care of parents or a loved one. So the care for the caregivers, can you speak on that and what you tell people that when they come in, and as you said, the family comes in, what is your advice if people are listening about that caregiver?
I think caregivers want to be everything to everyone. And we set these unrealistic expectations on ourselves as caregivers that you have to be able to do it all the time and perfectly and never get frustrated. And I would just say to give yourself grace, right? Because caregivers are at increased risk of their own health complications. We see more high blood pressure, we see a lot of depression, and not everyone experiences that with caregiving. For some people, there's a real flip side of joy and purpose. But caregiving takes a lot. And I think that's just what I come back to is giving yourself grace and giving yourself permission to acknowledge your limitations and to really ask for help and to not feel like you have to do it all on your own.
Yeah. And hopefully find some of these groups or places that offer some support. And I'm sure there's things that are all around us that are maybe groups that you can go and talk to and feel like you're supported.
Caregiving for someone living with memory loss is a skill. It has things you need to learn how to do, whether you're raising children, learning a new job at work, learning any other new skill that you want to do. You get information from outside sources, right? You're going to build up your own inherent skill set and your natural tendencies.
Right.
But we don't ever really learn how to do anything on our own without some guidance and help. And so, whether you're looking at a TikTok video or you're reading a book about being a new mom, or you're going to a support group in your local community, caregiving is the same, right? So we can learn from the collective knowledge gained from others. And so there are a number of different organizations that run support groups. You can find them online. You can do them from the privacy of your home. You can find them in person in your local community. And sometimes just understanding that you're not alone, even when things are hard,
Yeah.
goes a long way.
And you said that there's lots of books on it as well. But
Lots
do you
of
have a couple of favorites that you could share with our audience?
So there's the quintessential classic, The 36-Hour Day, which is
Yeah.
a wonderful book, but I think can sometimes be a little overwhelming. It's a lot to read if you're not living through those stages yet. It can be kind of scary. There's a nice book called Finding Moments of Joy, which really talks about how do we bring back purpose, bring back happiness and intentionality into the caregiving relationship, where you have a dynamic between two people fundamentally changing, but the love is still there, right? And so, how do we bring out that love and joy? And then I did write down one or two others that I particularly liked. There's one called Learning to Speak Alzheimer's, which is wonderful. And then if you are kind of a graphic novel person, there's two. One called Tangles, a story about Alzheimer's, My Mother and Me, and another one, Can't We Talk About Something More Pleasant, a memoir. And so right as you're flipping through these comics, you really do get the sense of, can't we talk about something more pleasant? But we got to talk about it because it's happening right in front of us.
Gotta talk about it. And you amaze me because, and people in your field, because you do talk about it every day. Can you share with me the story of you? I know you have probably dozens, but the story of the one patient that I think you asked them to refer to you as Christina.
Yeah. So several years ago, I had the opportunity to meet a really incredible woman, and I think her husband would be okay with me sharing it. We have become very close over the years. Her name was Betty, and she came to me for a second opinion. And over the course of several years, I first told her family that she did not have Alzheimer's disease. She was living with dementia with Lewy body. And over the course of her illness, as things really progressed, we had a tough day. We had a tough visit one day where we were talking about hard things. And I said to her husband, I'm going to be here with you for this whole journey. And he turned and he looked at me. He said, Christina, this is a odyssey. This is not a journey. A journey is something you look forward to and you plan for. This is not something anyone would ever choose. And so I've really changed also my own language and how I frame it. Because for some families, there is a lot of joy still, and it can be a journey. But for other families, whether it's because of their environment or the disease itself, or any of the other factors that go into living with Alzheimer's, it can be a trialing odyssey. And we have to just recognize that.
Yeah.
Meet those people where they're at.
Yeah. But it is, when you said that, I've had it in my family. And,
Yeah.
So when you say that, that is sometimes how it is. It feels like it's just long and it's hard. But there is hope out there, right? We can't go into all the studies, but there is hope, right? And hope in the fact that there's new ways to treat it.
We do have some new emerging treatments.
Yeah.
There are new blood biomarkers that are hopefully helping people get changes recognized earlier. And I honestly think just talking about it, right? It's good that we're talking about it. We have to talk about tough things because it empowers people to have the knowledge that they need to ask questions and say, I don't feel like I'm thinking well. Hey, doc, is there something I need to be doing differently? And that's where it starts, right? It starts by empowering people to have knowledge over their health.
And you said you want to see people earlier, not later.
I do. I love when I get a family member who's in the office with a parent saying, Doc, can I come in and see you? I want to talk about how to not have this happen to me, right? And so those are not the hardest emotional visits for me, right? But often we're diagnosing sleep apnea or talking about how to aggressively change diet or maybe motivating someone to make that change in their physical activity, which is going to be a long-term opportunity to improve their overall health independent of cognitive health.
And let's talk about, because I know people are listening and they're like, okay, you have this amazing expert sitting there, and can you tell us what are the top 3 ways to deal with the aging process? As you told me, we're all aging.
We're all aging, right? The alternative to aging is not aging.
Right.
So let's all age. And so the first one I would say is motion is lotion, right? So we've got to start moving. The moment we stop moving, we start dying. We have to move our bodies. It's so important. And then the second thing I would say is that as a community, as a people, we are all biased against aging, right? If you look around our entire culture, all of the products, all the clothes, how do we stay young? How do we remain young?
Sure.
We have to be aware that we are biased against our future selves and the fact that we're working really hard to not be our future selves. And so just to keep that in mind, to bring a little more grace and a little more love, and to think about that aging process as something natural and something we should, in a way, almost challenge ourselves to look forward to, because it means that we're living well.
I love that. So I have to ask you, when you tell people you're a geriatrician, what is the first thing that comes to mind? What can you share with our audience as you peel back the curtain on the world of being a geriatrician, a geriatric doctor?
So in the medical community, people go, oh, you're a geriatrician. There's a general sense of why would you go into that? It is not the most.
It can also be, oh.
Yeah. Oh, wow. Like that's hard. But geriatricians tend to actually have some of the highest job satisfaction and the longest duration of practice. So we have incredible relationships with our patients. We get to walk with people in a very privileged way through vulnerable moments in their lives, right? And I think to be able to be present with people through the complexities of aging and illness and trying to flip that to optimizing function, quality of life, ensuring we're aligning their care with what matters most, actively talking about joy, minimizing disability, it's an incredible privilege. And so I eagerly await for when the world sees it that way too.
I think they might after listening. I hope so, because you're doing amazing work, all of you, and we just appreciate you taking the time out of a very, very busy schedule to do this. You have spoken at so many seminars, symposiums, been on podcasts, so we just thank you for sharing your knowledge and your expertise with We're Good. It really is making a difference.
Well, we're good, and we're going to fix this and address it together.
Thank you. Thank you so much, Dr. Christina Prather, for being with us. Thank you for joining us. There has been so much in this episode that we hope you will share with others. Be sure to do so. You can also find out so much more about Dr. Prather and what's going on with her website. And we want to make sure that that will be on our website, so you can join us and take a look there. For now, thank you so much for being with us, because we're good and you're good, and we can all make a difference.